Hi, if you're doing MDS or are going to submit a library dissertation, this is a must-watch video. In this video, we are going to discuss about the difference between a library dissertation and a dissertation or thesis. The second and the most important thing we'll be discussing is what are the points you should consider while selecting your topic for library dissertation. And third, what are the contents of a library dissertation? I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. In a thesis or a dissertation, you have to do your own research, collect your primary data, and come to a conclusion. But in a library dissertation, you do not have to go out and collect primary data. You have to evaluate the research done by others. You have to create a small copy about all the current knowledge available on the given topic. Now, for example, if I read your library dissertation, I should not understand everything about the topic, from what was the previous research what was done, what is the current understanding or consensus about the topic, and in which direction the future research is going on. Let's take the example of dental implants. If I want to understand, based on the coating on the dental implant, what is the initial stability I will get while placing them on the bone. Now, if I have to do a thesis on the topic, I have to go and search various implants with different types of coatings, find similar patients and place them and understand the stability. Whereas if I'm doing a library dissertation, I do not have to do all these things. I have to go out there, find all the research which was previously done, evaluate, understand and write about it. Now, what are the three criteria you should consider while selecting your library dissertation topic? Criteria number one is relevancy. That is, your topic has to be relevant not just now, but for a few more years which are coming. The reason being, you're going to spend a lot of time and effort. You're going to be considered a semi-expert on that topic. So if anyone has doubts, since you have read a lot about it, they will come to you. So you do not want to be an expert on a topic which is absolutely not relevant. For example, when I was doing my MDS, I knew someone who was doing a library dissertation on the different types of cement bases below silver amalgam fillings. And already by that time, silver amalgam was on its way out. You do not want to be an expert in something which has no use. So find relevance of a given topic, not just today, which you feel might be useful, say 4 to 5 years or maybe even 10 years down the line. The second point you need to consider is interest. Yes, you should be interested in the topic which you're doing, because since you'll be spending a lot of time reading research articles about it, if you do not like it, just because someone else told you took the topic, you would get bored and might not do a good job. Other than your interest, you should also consider the interest of your guide or mentor who would be helping you through the process. Because if you get stuck somewhere, it is their expertise which will come in handy. So take into consideration both yours and your mentor's interest while selecting the topic. Before I tell you the third point, if you're liking this video, please do not forget to hit the like button below. This motivates us to come up with more such similar content. So if you're an MDS student, please do not forget to subscribe to the channel, because we are going to come with a lot of content for MDS students out there. The third point you should consider while selecting your library dissertation topic is the data availability. The reason being, a library dissertation might vary from say 40 pages to 150 pages depending upon your university and college. For that, you need to have enough data. So if you go in for a topic which has very minuscule amount of data available, it becomes extremely difficult to complete it. On the other hand, if you go in for a topic which has a lot of research data available, you will have to spend a lot of time scanning through them, taking out what is relevant for you, and coming up with your entire library dissertation. So it's always better to find a library dissertation topic in which there is enough research done for you to make it, but not so much that you get overwhelmed by it. Now, a library dissertation has various sections. In your first section, you would have your title, your acknowledgement, your table of contents and abstract. One suggestion here is, when you are writing your acknowledgement, do not forget to mention all those people who would be associated with your MDS. The reason being, yes, they might not have helped you during your library dissertation, but they might help you during your thesis or other things which you would require during your MDS. For example, case presentations and others. Remember, do not be stingy when it comes to giving acknowledgement to others. A little bit of acknowledgement might motivate them and feel that you consider them a part of your MDS journey. Then comes the second section, which includes your introduction and the main chapters of your library dissertation. In the introduction, you have to explain why is this topic relevant, why are you working on it, and how is it going to help the reader. The third section involves discussions, conclusions, and references. The problem I've seen a lot of young postgraduates face is when they are writing it down, they do not pay attention to the references. And later, they are scrambling to find out from where they found what and to put it in a specific pattern. So my suggestion is, as you are sorting out your content and creating the file for your library dissertation, see that you're working on the references simultaneously. There are various referencing styles in which you have to mention that article you have used. So depending upon your university and college, understand what referencing file system you have to follow and see that you're following it from the start so that later you do not spend a lot of time just in making the reference section. I hope you found this information valuable, and if you're doing MDS, please do not forget to watch our entire playlist which we are making for you guys. I'm Dr. Satish Kumar, this is Kaizen Dental. Our aim here is to help dentists succeed.